Well, Julie, what brings you in today?
Well, I'm coming in to see about getting a breast lift and augmentation.
Okay. Have you had kids?
Yes, 3.
Okay. And have you dropped down a lot?
Yes, I have. I used to be a lot more, volume up
Full.
here, full up there. But now I'm not. I kind of lost that with losing the baby weight and breastfeeding.
Yeah. Well, something like this is very common and is relatively straightforward to correct. To restore the volume, we'll need to do a little bit of an augmentation, not much, but if we don't do the augmentation, I'm afraid you're going to look a little empty up there afterwards. But we can definitely take out the excess skin and get you looking the way you used to.
Great. That's what I want.
The procedure today will take about 2 to 2.5 hours to do. The reason it takes that long is there's a lot of tailoring. It's a very sort of a time-intensive and not tedious, but a meticulous procedure because, we'll put in a stitch, do we like it, do we not, and then we'll take it out, trim the skin, put it in, that's better, leave that one, go to the next, so to speak. So it's a lot of trial and error to get it right because it's not a one-size-fits-all pattern by any means.
Right. My only concern, after the surgery, is how much pain and healing time would I expect?
Obviously, I'm not here to say that it's pain-free, but it's very easily managed on your pain pills.
Okay.
And those pain pills, while strong, will still enable you to function.
I'm very excited. I had a little bit of nervousness the night before, but last night I was really excited, and I think my kids were getting a little bit more nervous for me than I was, so especially the younger one. She didn't kind of want Mom to leave, and I'm like, Mommy, you'll be back,
That's natural.
Yes. But I'm excited. I'm ready for it. It's something I've wanted for a long time, ever since I had, my first 2 children, my older children that are teenagers now. So they,
Okay.
are 15, 16. They understand,
Mm-hmm.
what Mom's doing. And,
Sure.
and once we finally decided that kids were no longer, going to be coming anymore, and we were done having those, and it was time.
Well, you're going to love the way you look. You really will.
Great. I hope so. I'm sure I will.
The procedure is a very reliable one and a very predictable one in terms of getting good results and happy patients.